Welcome to the Nurse Gwenny Podcast, where we talk real-life, high-acuity, evidence-based care for the trauma bay, the truck, and the aircraft. Before we jump in, a quick but super important disclaimer. This podcast is for educational and informational purposes only. Always practice within your own scope, certification level, and local protocols. Follow your state regulations, your medical director's guidance, and your facility policies. The views and opinions expressed by me and any guests are our own and do not represent the views of our employers, affiliates, or organizations. While we make every effort to reference current evidence-based literature and provide accurate, up-to-date information, we are human. Medicine evolves, guidelines change. It is your responsibility to verify information, review primary resources, and apply clinical judgment to your own patient population. Now, if you're loving this content and want to get continuing education for it, head on over to the Nurse Gwenny Library, my online educational platform where you can access long-form content, including my comprehensive critical care transport course, Flight Ready. If you're going to listen anyway, you might as well get CE for it. You can find everything at library.nursegwenny.com. And finally, this content is copyrighted by Nurse Gwenny, LLC. And while sharing is caring, reproducing without written permission is not. This podcast may not be reproduced, redistributed, or repurposed without written consent. All right, enough yapping. Let's jump in.
The first 2 weeks that you're a nurse, you learn way more than you did in nursing school. You need all of that background information, but you're like, what? My mind is blown right now with the stuff that I just did.
Welcome back to the Nurse Gwenny Podcast. Guys, I'm so pumped for the guest we have today. She is a flight paramedic for a legacy program. Let me introduce you to my friend, Katelyn.
Hi guys, thank you so much for having me. I truly appreciate to be able to be here.
Yeah, I think a lot of our TikTok crowd are going to recognize your voice, or if they're watching on YouTube or in the Nurse Gwenny Library, they can see you also. They're going to recognize you from your exponential rise in popularity that you have had lately, because you are knocking it out of the park doing a lot of patho videos. So tell us a little bit about the work you've been doing online.
So for me, I work our program is a dually licensed program. So I'm both a nurse and a medic. So it's kind of weird, but I think it gives me a little bit better idea to gauge people on how to educate them, hopefully, because a lot of times, obviously, a nurse and a paramedic are a little bit different on the way we're taught, the things that we can do. So I try to imagine that when I'm talking to you guys. The other thing I try to remember is when I was back in nursing school, I had some really good preceptors who taught me in a different way than just from a book, something that I could actually understand. So I try to, when I do a video, I try to talk to you guys in that way, hopefully, so you can actually understand something. I think once we actually understand something, then we remember it, right? When I read something in a book that I kind of get, but I don't really care about, it's in one ear, out the other. So I try to talk to you guys, and you're like, oh, she's, being nice, she's putting it on a level that I can understand. No, I'm putting it on a level I can understand, truly.
Yes.
Because that's the way I'm trying to give it to you. So never think that I know a lot, because the way I'm telling it to you is just kind of how my brain works. And I just hope that it works for you guys too.
Yes, absolutely. I 100% agree with your philosophy of education. And I do think this is a rapidly growing kind of niche part of education, particularly in our industry of nursing and EMS. Is that for so long, people have been forced into this one specific way of textbook learning, and it just doesn't work for so many people. And we've just been skating by. But now that, there are a few instructors like you and I and several others out there who are figuring out how to make these concepts easy for students to comprehend, I really think that it is increasing our care that we're delivering to our patients, because we are actually grasping these concepts.
Hold up. If you're loving this podcast, you're definitely going to love Nurse Gwenny's long-form content over in the Nurse Gwenny Library. Get CEs for podcasts like this, along with content on pathophysiology, pharmacology, cardiology, and a whole bunch more ologies. Find it at nursegwenny.com.
So you said something a few minutes ago that I didn't know. I didn't know you were a dual nurse and medic. Which one did you do first?
So it was weird. It's a totally not the right way to do it, which is totally fine. It doesn't matter how you do it. But I got my EMT out of high school, knew I wanted to do healthcare, went back, got my nursing, and then when I was a nurse, I went back and got my medic because I knew I wanted to do like this program that I work for currently. And they only hire you if you're duly licensed. So that was like kind of my pathway of getting in there.
Excellent. I love that. Well, I had the privilege of meeting you in person last October at the Emergency Care Updates Conference in Irving, Texas, put on by CareFlight, which is another legacy program out there, which, side note, I totally love. That's one of my favorite conferences I've ever been to, and I'm going back this year. You're coming back too, right?
I hope so. I think I turned in 1 or 2 lectures. So, well, I'm waiting to hear back. So hopefully.
Excellent. Well, I can't wait to see you there. I'm actually emceeing the event this year instead of speaking at it, and it's going to be
cool.
So much fun. So if any of the listeners are looking for a conference to go to this year, it'll be in October. This is 2026 if you're listening to this years down the road. But they put it on every fall, and it's a phenomenal 2-day symposium where you're going to learn so much. But I got to meet you there. And in all of your videos, your nameplate says flight paramedic. Maybe it says nursing, and I just haven't looked closely enough. But what do you think?
Sure.
You definitely had the vibe of paramedic when I met you. Like, I feel like I did it wrong. Like, I went to nursing school, but I feel like I've always fit in better with the paramedic crowd. I don't know what it is. I do love what I get to do with nursing. I'm just rambling now, but as you can tell, I probably have ADHD, but I'm clearly unmedicated. All right. So what I want us to go through today is to share some lessons with the listeners of things that you and I wish we would have learned way sooner in our careers as nurses, paramedics, flight clinicians, etc. So open it up, take the floor, tell us one lesson that you wish you would have learned way earlier in your career as a nurse and paramedic.
Oh, man, there's so many, so please don't think that this is the number one for sure. But I think one of the biggest things is seeking out a resource in whatever you're doing, whether that's nursing, whether it's paramedic, whether it's you're not very good at EKGs or you're not good at vent stuff, whatever that is that you find that you lack in that skill. I think it's super important to find someone who, 1, wants to teach you, and 2, knows that knowledge, and you're able to reach out to them and have these type of discussions, because that's when you truly learn, is when you feel comfortable to ask questions, right? Because it's funny when I go talk to like nursing students, I love being in class with them because I'll ask a question and it's dead silent, right? And I'm like, who cares? Who cares if you get it wrong? I don't care, right? Like, I really don't care. It doesn't matter to me. But I feel like when you do get something wrong, you remember it more. And it's actually proven. I'm a nerd, so there is actual articles out there and journal articles that it's proven that when you mess up, you actually learn more. So my concept is I would much rather mess up on, a simulation or a fake patient or a discussion rather than my actual patient, right?
Yeah, we learn way more from our mistakes than we do our successes.
Yeah, 100%. So I think that's one of the biggest things that and it comes with time, unfortunately, and nobody wants to hear that. Like, oh, it takes time. We always say that. It is the truth, but you can do things that kind of speed up your experience, or make it better. I mean, one of those things is like seeking out those resources and being comfortable with asking questions that might seem dumb or that are wrong, because you're actually going to learn more from them when you have those type of discussions. But unfortunately, I mean, I do it too. I don't want to walk into a room where there's a bunch of people I don't know and seem stupid, right? Nobody wants to do that.
Yeah.
But you will learn so much more when you have an open mind. But that's why I said it's important to find those people who don't care if you get it wrong, right? Who cares? They don't judge you. They, they help you. They teach you because they realize you don't understand it. So I think if you can find something like that, and I wish I would have done that more, because I think I would have been accelerated, learned more quicker if I would have done that. But again, that's it takes time. It's a maturity thing. Nobody wants to hear that, but it's honest to God truth. But I think that's one thing that I would go back and tell myself, like, hey, find some people you're comfortable with who know a little bit of stuff that you're trying to learn, and just be honest with them and ask them questions and try to learn from them.
Yeah, I totally agree with everything that you're saying. And to build on that, it's not just finding people who will give you the answers, but it's also becoming a resource for yourself, especially in today's age of having so many free resources available to you. Like Life in the Fast Lane, I pretty much always have a tab open on my computer that's pulled up to Life in the Fast Lane because it's such a great resource for learning, especially cardiology and critical care topics where I can go deep dive it. And if I'm not happy with how much I've learned there, I just scroll down to the resources that were used to build that web page and I go visit those and keep deep diving it. Not just seeking out people who can help us, but also becoming a person who can help us. And I know that I learn from my mistakes, and when I mess up, I learned from those really well, but I also learn and retain information better when I had to go learn it myself, right? And deep diving those difficult topics and finding for a way for it to click within my own head. And then I feel like I'm better suited to teach others those difficult concepts. And another thing you said that I agree with was it just takes time. It takes experience for us to get good at this. Just like any skill, whether it's when you were a toddler and learning to walk, or when you were learning to tie your shoe. Remember when you first learned to tie your shoe? It took you like 11 minutes, and our parents were like trying not to pull their hair out, like, come on, we need to leave the house. But they know that they need to let you struggle a little bit to really learn how to tie your shoe. And now most of us can tie our shoe in about 6 seconds, and we're pretty good at it. The same goes for our patient care or our understanding of various pathologies, pharmacology, etc. Some of it just takes the reps. But I have found that one good surrogate for actual patient care, like you said, is simulations or even just tabletop discussions. So if we're not out on flights, we can discuss with our partner, hey, there's another crew that ran XYZ patient yesterday. Let's talk through if that were us. How would we proceed with that patient? Would we do it just the way that other crew did? Or are there ways that we could maybe have tweaked our care and done a little bit better? And just talking through it. And that builds another rep of kind of a surrogate for patient care that can help build that knowledge base.
Yeah. And like I will say, obviously, where you work, you're going to be like, oh, it's great, right? Because that's what you do. But one of the things that I do love that we do at our company is we have weekly rounds. So what we do is we split them up usually into like adult, pediatric, ECMO, special kind of cases, and we'll review those once a week. So we have like a 2-hour, it's usually a Tuesday, we do it for 2 hours, and we do exactly what you just talked about. Like, we go through that whole case, we talk about like, hey, what drugs did you use? Why did you use that? Let's look at your ultrasound, so it's like, because I don't get to go on every call, right? We just can't. There's no way. So like me being able to sit down, listen, hear what you did, think in my mind, well, what would I have done? And why would I have done that? And then learn from that. It gets me that experience without ever actually going on that call, because we won't be able to go on everything. There's no way. And that's like, unfortunately, and I don't mean to speak down on anyone, any company, paramedic, nursing, no matter what, but when you look at the bottom line, they want you to pass a test, right? That's what they're training you for. Mm-hmm. Yes, you're going to have teachers who do a phenomenal job and they really prepare you for the job. But like at the end of the day, they need to have a high success rate because they want people to come to their course and pass the test, right? But unfortunately, we've gotten away from teaching you what it is to be, like, to do the job. And I always joke with people, but it's the honest to God truth, and I know you'll agree, but the first 2 weeks that you're a nurse, you learn, like, way more than you did in nursing school. Like, you need all of that background information, but you're like, what? Like, my mind is blown right now with the stuff that I just did. But you can't learn all of that in school. There's no way. And they know that. But you can speed up that progress of learning by just immersing yourself. Like, this is my ongoing joke too, is I will, like, wherever I worked, I would be that person with a flush in the corner, like, just looking, but I have a flush in case I need to help you, right? Like, but I was in that scene, right? So I'm like, oh, what do they do? And it's not my patient, but like, what are they doing? Why are they doing that? You know? But I'm here with the flush if you need me, you know? So like, get yourself into those situations because it helps you learn so much. That I can't preach that enough to try to do that.
Right. Like, don't mind your own business, right? Like, put your nose in other cases and learn, right? Of course, there's a range of that, of what's appropriate and what's not. But yeah, get in there and let people know that you're interested in learning. But because there are so many great teachers out there that might not be in a position of being like a capacity of an educator, but they have that skill set and that willingness. Like I worked for about 3 years at a teaching hospital in the emergency department, and there would be residents who would teach us just awesome things. We had a great set of attendings, and if they know that you're a person who loves to learn and you're constantly inviting that mentorship in, then people are going to, when they know something cool, they're going to seek you out and teach you. And what a position to be in, to be where people are going to seek you out to teach you cool things. So yes, excellent thing. I wish I would have figured out much earlier in my career. All right, Katelyn, hit us with another one. What's something else you wish you would have known earlier in your career?
For me, this is crazy, but where I work, and a lot of people will agree with this, I come from a big hospital. We have resources at every corner, like truly. Every specialty, everything that you can think of, we have. But at the end of the day, sometimes what that ends up doing is you, as a nurse or whoever, wherever you're working, you kind of actually lose some skills because you don't have to do those things. And like the one thing that I think of is like mixing drugs. That's like unheard of at our hospital because the pharmacy does that, right? But in my job now, I have to do that, So that's something I missed out on, and I didn't even realize that I missed out on it because it's just a everyday normal thing. That's just what we do. Same thing with like we have a lot of rural areas where I live. So a lot of times we're getting called because that hospital has truly used every resource to the max capacity and they just don't have any more. And I remember one time walking in and being like, okay, well, they need blood. And they're like, we don't have blood. And I'm like, what? Something that we take for granted, like something that any hospital has, they don't have. So I think like just because you don't work at a level 1 or like a big hospital, don't discredit yourself because you can learn a ton in an environment like that. And that's something I think I didn't realize. And I think when you're like out of school, it's kind of the same thing when you're like you're almost graduated from high school and they're like, you need to go to an Ivy League school, It's like the same thing when you graduate nursing. They're like, you need to go to a level 1, like, and granted, if that's what you want to do, by all means, do it. More power to you. But please, if you work somewhere else, like, don't discredit yourself because some of the stuff you're doing, people wouldn't even know how to do that nowadays. So that's something I wish I would have realized and to give them more credit, man. Like I said, some of the places we go to, they're like, we don't have a CT. We just called the respiratory therapist in from home because they're on call and the doc. What? So I give you guys mad credit for doing that stuff.
Some of the most skilled nurses and clinicians I have ever seen are critical access hospital nurses because they can't rely on the physician grabbing the ultrasound and doing a bedside ultrasound or, having a CT or being able to get an emergent MRI. They are relying on clinical assessment skills. And during COVID, I did a couple of contracts at a critical access hospital, and I was the only nurse in the hospital at night for inpatient, labor and delivery, and emergency department. We had no provider, nobody from lab, nobody from imaging. It was me and either a tech or an LPN overnight. That was it, the two of us. If someone wanted something to eat, I would have to take my happy ass down to the kitchen and make them something to eat. Like when we had a tornado one time that hit, it was out in the middle of nowhere, Kansas, and it was me and the LPN running as many people as we could down to the basement, and then, trying to like run the hospital, and emergency patients still coming in. It's crazy what critical access nurses have to be able to do. And I also do some medical relief work in a developing nation. There's one CT scanner in the whole damn country where I go. And so you can't rely, you have to rely on your clinical assessment skills. And I find that I get a little bit lazy in my clinical assessment, kind of resting on my laurels when I'm working in the ER, where I know we're going to scan that patient. What's the point of me auscultating in 13 different fields of their lungs, when I know that they're just going to get a chest x-rays waiting outside the door right now, right? But I think one of the important lessons is don't rest on your laurels. Those skills, those assessment skills, and that clinical gestalt, it is perishable. And if we don't maintain it, we can lose that. And so it's important for me to remember the urgency and the importance of caring for those skills I've worked so hard to develop, or else I'll lose them.
Yeah. And I'm sure a lot of people who are listening want to be flight, right? Obviously, because that's what you talk about a lot. When we're in flight, you are basically a critical access hospital, right? You don't have a button you can push and get help. I don't have a CT. Yes, we have like some really cool things that we can use, but like you have to have such a foundation of your assessment skills, and just like that that old school nurse who can sniff out like Pseudomonas or C. diff, like those are the skills that you want to have, because you don't have those resources anymore when you become a flight nurse or a flight paramedic, because you're in this teeny little aircraft with a critical patient who, my favorite is, oh, hey, we can't turn them, they're gonna die. And you're like, oh, so we just have to move them 10 times into an aircraft.
Right?
It'll be great.
And then we're going to totally blast them with every kind of stimuli that we can. Like, it's going to be super loud. It's going to be bumpy and vibrate the entire flight. And it's a windy day, so when we land, we're actually going to land 3 different times as the skids kind of pitter-patter onto, right? And these, you're right, those patients who, if you just make eye contact with them, they're kicking the bucket. Like, they got one foot in the grave and the other in a banana peel, and they are so, so sensitive. Kind of building on something that you mentioned just a couple of minutes ago, one of my lessons that I have on the note on my phone that I started of lessons I wish I would have learned earlier, the fine art of titrating vasopressors. I get so many questions from followers, like, how do I learn to titrate pressors? Because most of us have pretty much the same, in the ballpark, the same protocols for titrating our vasopressors, whether it's weight-based levo or just, 2 to 30 mics per minute. When I was a new flight clinician and I didn't have, I wasn't in the ER where the doctor's telling me exactly where they want the levo started at, and I was relying on my own kind of nuanced ability to titrate these pressors, I would start everybody at the lowest dose possible because I was afraid to give too much, and I got burnt in the ass more times than I would care to admit of how many times that I should have started with a more aggressive dose, right? And now I can kind of look at a patient and I can go like, I need to start at 20 mics a minute of levo. Weight-based is so much math. I really just prefer 2 to 30. So I need to start at a pretty aggressive dose of the levo, and I'm probably going to have to start vaso really quick after this, or I know which patients are going to do better with which second line pressor, right? So how have you learned to titrate pressors on your patients, and would you agree that that is kind of a fine art that just has to be experienced to?
Yeah, unfortunately, right, we're going to tell you, it comes with time, but it seriously does. Yeah. Because I'm in the same boat. Like, in my mind, I can always give more, right? Like, that was my understanding. Yeah. But in a presser, for instance, the reason I'm giving it is because you're not perfusing, right? So if I get your blood pressure a little bit too high, okay, obviously I don't want you at stroke level. That's not good either.
Right.
But I would do the same thing. I would start slow, and then I'm like, oh, well, I got to go up a little bit, and I got to go up every 2 minutes because that's what's written, like that's the order, and I can only go up by 0.02, that, unfortunately, that's what you're used to, because that's what you're trained to do at work, right? When you're in the hospital field. But,
yeah.
And I can't speak for other programs, like how they do it. We have, I say this loosely, we have guidelines, is what we call them. And it's parentheses.
Yes.
Because it's something like, if crap's hitting the fan, I can refer to it like, oh yeah, okay, that's a good idea. But it by no means is, I have to follow this word for word.
Right.
So, like, if I wanted to start someone on one of Levofed, when we run our sorry on mics per gig per minute, that's the max. Like, I could do that. Would I? That's pretty high. I probably wouldn't unless something catastrophic is happening. You kind of learn, and like you said it perfectly. You can walk in a room and be like, yeah, fluid isn't going to help this person. There's no way. Like, they're going to need it.
Right.
And you just know by what they look like. And unfortunately, that takes time. I think a safe bet, and again, we run our mics per gig per minute, is I'll usually start you at like 0.05 and kind of go up from there. I won't start you at the 0.01, which is what we can start at, because like that's a whiff of Levo is what we call it. Like,
right? Yeah, you might as well just spit on them.
Yeah, legit. You're just giving them a little loogie of Levofed. So we would start higher than that, but unfortunately, no, there's not a great, way of me telling you, oh, if you do it this way, it'll work. And in that, like, if this is another, like, thing I wish I would have known about nursing is nothing is black and white. Everything is gray.
For sure.
There's nothing that's going to, like, be perfect, unfortunately. It's going to be all over the place depending on what you're doing.
Yes, I think medicine, so much of it is an art. It is a skill that has to be developed and refined, and we've never reached a point of arrival of like, oh, yep, I know everything there is to know. I'm as good as I can possibly get. I don't have to work any harder. Bull crap. No, we always have to be learning, growing, challenging each other, and I've been looking forward to doing this podcast with you because I'm thinking like, I can't wait for what I'm going to learn from her. All right, so give us at least one more thing that you wish you would have learned earlier in your career, and it even could be an understanding of a pathology that just one day clicked for you.
Oh, I just did a video on, a little bit ago, but calcium. This absolutely blew my mind, and it's not something we talk about, at least at bedside for me, my experience. It was never like, okay, we got to check, like, they're hypotensive, we need to check a calcium. It was always like, calcium's an electrolyte, let's check it, you want your potassium to be normal, you want your calcium to be normal. And I understood that, right? I understood that the body functions well when those electrolytes are in their appropriate way, but I didn't know. It wasn't even that I, like, kind of knew. It was I straight up didn't know that calcium is going to cause your vasculature to constrict. And if you don't have it, it doesn't matter how many pressors you're on, that is what makes your pressors work. So, like, mind-boggling, right?
I think you're exactly right. We don't give calcium the respect that it deserves. We care a whole lot. We get real wrapped up around the axle about potassium, right? Because we know that, like, if potassium is off even just a little bit, it can cause big problems in the heart, in the myocardium. But we don't give enough respect to calcium. And we know that calcium plays a part in so many processes in our body. It plays a part in our muscular function, right? So our cardiac function depends on appropriate amounts of calcium. The clotting cascade requires calcium to be part of it. And then our response to vasopressors. You are exactly right that calcium is required for so many things that we've been sleeping on calcium. Maybe we need to be highlighting that a little bit more and focusing on that. So yes, I love it. For me, I distinctly remember the moment I had like an aha moment about balloon pumps. I could not, when I first started flying, And I was studying for my CFRN, and we weren't a balloon pump base, but I was memorizing the test answers so that I could pass my CFRN. And that's what I did. I memorized the test answers, like rust-colored flakes in the tubing means ruptured balloon. And, this kind of waveform, this shape means late deflate. I memorized all those test answers, but I didn't understand how it worked. And I thought, this is so complicated. Why on earth would we ever put a balloon pump in when we could just do an impella? That makes a lot more sense, to just grab the blood from the left ventricle and shoot it out into the aorta. Isn't that fixing the problem? And then once I deep dove balloon pumps, and I got to actually see them in the clinical setting once I moved to a different flight program where we do use balloon pumps, it totally clicked for me. And I was like, this accomplishes a completely different task than we're looking for in the impella. The impella is just moving blood forward. However, the balloon pump is squirting that blood backwards into the coronary arteries. So it's improving my perfusion specifically to the coronary arteries, right? And it's easing the workload on the left side of the heart. So of course there are indications for when a balloon pump is way more appropriate than an impella. And I will tell you, as an instructor, watching other students have those aha moments, dopamine hit, totally keeps me going on the days when I'm like, why do I have to get up and make another stinking video? Because for somebody, it might be one of those aha moments. Are you hearing from your followers on TikTok like, oh my gosh, thank you so much?
Yeah, and it's so cool. Like, I can't tell you guys enough. Like, you might be like, oh, she doesn't care, or like, oh, she's, like there's too much things going on. I read every single one of the comments. Like, I truly do. Because one, it makes me better, right? Two, I want to see what you guys think, right? Because I have a problem. I could talk all day about the stuff that I do because I love what I do, unfortunately. So you have to listen to me. But, like, to hear what you guys think, phenomenal. And, like, it's funny because our program, they put me in charge of, like, outreach. And I was like, okay, if you give me the reins, like, I'm gonna do it. I'm gonna go for it, just so you know. And they were like, yeah, do whatever you want. And I was like, all right, here we go. But my mindset is, because I was in your shoes, like, I'll tell anybody any day, I was a fangirl for, like, my job. I like groupie, whatever you want to call me. Like I said, you need a flush, I got you. I'm there.
Yeah.
Because this is what I wanted to do. So to be here doing what I want to do, and then seeing people who are in my shoes, like, I can't explain to you how cool that is. And if I can help one person, like, understand a topic, or have the epiphany moment of, like, no way, then my hour spent editing my video and taking out all of the mistakes I made, totally worth it. Because we need people out there to teach, and anyone and everybody who will listen, because we just don't have enough. We don't have enough good educators out there. And unfortunately, like, for anything that you're learning, doesn't matter if it's healthcare, it's anything, most, like 99% of the things are taught via book, right? Like, you need to understand this by reading. If you actually look at, like, literature, we don't do good reading. We don't learn well. We are hands-on.
Right. Yes.
We're visual learners. So we're doing everyone a disservice by saying, read this, and you need to know it. When I'm giving you something that you can't understand, because that's not the way you learn. Like, that's horrible. Yeah. So I hope that we can give you, right, like, some other way of learning and understanding it. Like I said, have those big, like, epiphany moments, like the balloon pump. When I found that out, I was like, I hate this thing with a passion. It weighs 800 pounds. Whoever engineered this, like, I don't like you, unfortunately. But, like, when you look at it, you're like, okay, this totally makes sense. Like, I understand why we're using it.
Yes, agree. I love to hear you talking about the data and the literature behind learning. I, too, love diving into learning about learning, and all the literature, all the studies that have been done about learning, and our learners have changed drastically since 2020, right? COVID totally changed the learning experience. I had a college professor 20 some years ago when I went to college for my first bachelor's degree. She said, never, ever, ever read anything without a pen in your hand, because you put a pen in your hand, you start underlining things or circling things or putting a little asterisk by something to say, ooh, I need to go find out some more about that. She said, you are now engaging more parts of your brain. And so my books, I'm currently working on a CEN review book. And I'm writing it much like the style of my But Why, which is my CFRN FPC prep book. My rationales that I have on those, every single rationale has part of it is bold, some of it might be underlined, and I use italics, but then I also have a graphic over here and lots of room in the margins for notes, because the literature that studies learning says, even if you can just put a highlighter in your hand and you're engaging then a motor skill and not just the sensory skill of reading. And then if you read it out loud, you're also hearing it and engaging auditory learning. And so yes, just reading from a book isn't going to retain much of that information, but you can level up with a book simply by putting a pen in your hand and circling things, underlining it. Go back if there's something that's like really it's the author is emphasizing that and you really want to get that information to stick, read it out loud and you will retain more of that information. And so I think it's also some of the onus is on the learner to understand themselves and to have the self-awareness to say, okay, I'm an auditory learner, so podcasts are going to be what works for me, or I'm a visual learner, or I'm a tactile learner. And so while I'm listening to this podcast, I need to have some silly putty in my hands and engaging those motor muscles, right, to really help that learning.
Yeah.
I love everything that you have shared today. I have enjoyed this conversation. I love the little bit that you were preaching about calcium and how important that is. And guys, if you want to know more about that, I saw your video about calcium that you did. That was probably like 2 or 3 weeks ago that you did it?
Yeah, at least I would say probably.
Go back and find that video and watch it. Be sure to subscribe to her. Follow her on all of the platforms. And I promise if you like my style of teaching, you are going to love Katelyn's videos too, because I have enjoyed watching them and I really am enjoying seeing your page grow. Katelyn, I have to say, I'm so thankful that it really seems like the chapter of nursing to where it was standard to eat your young, that is closed, done. We have left that in the past. And what I see from you is that you are extending a hand to other nurses and paramedics who might want to do flight someday, or they just want to be better in the role that they are in. And I imagine, as you were talking earlier, I kind of had this visual of a whole bunch of us on a big rock pile in Colorado, like we're just scrambling, right? And we're all just helping each other. Like there might be one area where like you were able to climb up on it really well, and so you extend a hand and pull me up. And then there might be another one that I got up there first, and so I help you. And so we as a nursing community and as TikTok creators, etc., we're all just helping each other learn new concepts and really grasp this information. And I love it. And I am here for your style of teaching. So thank you so much for sharing some of your wisdom and your knowledge. I want to ask you one question before we wrap it up today. And this is a question that I'm going to start asking all of my podcast guests. I've started doing it with my kids recently, and it's so much fun. Tell me something that you are proud of yourself for in the last couple of days or maybe week. What are you proud of yourself for doing recently?
I think venturing out, like I said, I like to educate, right? I like to make these videos, but I am actually kind of stepping into like a new thing. I'm doing something with a CCRN review, so that's new for me.
Yeah.
I despise the CCRN. It's like the NCLEX. Nobody ever wants to take
it was
that
awful.
kind of test again.
Yeah. No, horrible. I cried.
So I feel that. I feel that.
The woman said, you passed, and she handed me the paper, and I did like a hard cry, snot bubbles, cry hiccups, the whole 9 yards. It was awful.
Yeah, it's not, when they tell you like, oh, you only have to take the NCLEX once, they lied to you, because I feel like the CCRN is very similar to that. So I'm proud of like stepping out, because for me, that's not a strong suit, right? Like I just told you, I did not want to take that test. It's a hard test. I really tried to study for it. So I'm really excited for that. And like I said, we're trying to make it for every type of learner. So that is what I'm excited about. So hopefully, like I said, it will go well, but I'm just excited to do something, like step out of my comfort zone. My comfort zone is like, and you might feel the same way, but like you put on that suit, and for me, this is cheesy, but it's kind of like Superman, right? Like I got that suit on, I do this job, I've trained to do it, I'm ready to do it, but then when I'm at home and I'm in my sweatpants, I surely don't feel, I don't feel like Superman anymore. That suit does something. So I'm excited to like not be in that suit and try to do something like that.
Excellent. Well, I'm proud of you too. Great work.
Thank you. I appreciate that.
All right, guys, thanks so much for listening. If you want to catch the video version of this, check it out on YouTube, or it's always available with accreditation so that you get CEUs for it in the Nurse Gwenny library. Check it out at www.nursegwenny.com.
Thanks for listening to the Nurse Gwenny Podcast. If you want to earn continuing education credits for this episode and much more, head on over to the Nurse Gwenny library, where learning is fun and nerds are cool, at www.nursegwenny.com, where your subscription gets you access to long-form content like my critical care prep course, Flight Ready, podcasts, clusters of micro-learning, and so much more. Remember to be kind to others, be kind to yourself, and always keep learning.